Hello, my name is Takita Snyder, and this presentation summarizes my Nursing 430 project called Small Interventions, Big Impact, Non-Pharmacological Pain Relief. This project was completed at Samaritan Pacific Health Services on the Medical Surgical Unit. The purpose of the project was to educate nursing staff about evidence-based complementary pain management strategies that can be used alongside medications to improve patient comfort and support holistic care. During this presentation, I will review the project goals, implementation process, outcomes, and recommendations for future practice. I certify that this presentation represents my own original work completed according to the nursing program's academic integrity standards. Introduction. Pain management is a critical component of nursing care, especially within the medical surgical setting. While medications remain an important part of treatment, evidence supports the use of multimodal pain management approaches that can combine pharmacological and non-pharmacological interventions. Complementary interventions can improve comfort, reduce anxiety, promote mobility, and enhance patient satisfaction. The purpose of this project was to increase the knowledge of nursing staff related to the awareness and understanding of evidence-based non-pharmacological pain management techniques and encourage their incorporation into routine patient care. Project goal and objective 1. The overall goal of this project was to improve awareness and understanding of complementary pain management strategies among nursing staff. During Objective 1, I conducted a literature review using current peer-reviewed evidence and national recommendations. 5 evidence-based interventions that were selected: relaxation and deep breathing, heat therapy, cold therapy, positioning and repositioning, and lastly, mobility and ambulation. These findings were used to develop an educational resource for staff to use. Objectives 2 and 3. The second objective focused on implementation. Education was delivered through staff huddles, informal discussions, and a unit presentation board. The third objective involved evaluation of the project, staff feedback was collected, surveys were analyzed, documentation data was reviewed. These activities allowed me to evaluate whether the education improved understanding of complementary pain management techniques and identify opportunities for improvement. Strategies completed. Several strategies were completed during the project. A comprehensive literature review was conducted, and an annotated bibliography was developed to support the educational content. An evidence-based educational poster was created and reviewed by my mentor. After revisions were made based on mentor recommendations, the educational materials were approved and presented to the nursing staff. These activities establish a strong evidence-based foundation for the project. Evidence of completion. Evidence of project completion included the educational poster, as you see here in the picture, survey responses, staff feedback summaries, documentation review, and project outcome analysis. These materials demonstrate that the project was implemented successfully and provided data for evaluating the effectiveness of the educational intervention. Outcomes for the nursing unit. The project produced several positive outcomes for the nursing unit. Staff reported increased awareness of non-pharmacological pain management strategies and improved confidence in implementing these interventions. Feedback indicated that the educational materials were useful, relevant, and easy to apply in practice. However, documentation or data reviewed only minimal changes in charting of non-pharmacological interventions, suggesting that additional reinforcement may be needed to influence long-term practice behaviors. Survey results. Survey results demonstrated that staff already recognize the value of non-pharmacological interventions. All respondents reported using complementary interventions at least occasionally and believe these interventions were effective. Most staff reported routinely reassessing pain following interventions, and a majority described themselves as highly confident in implementing non-pharmacological pain management techniques. Overall, the survey findings support the effectiveness of the educational intervention in increasing awareness and confidence. Application to practice and lifelong learning. This project has important implications of nursing practice, education, and quality improvement, promotes a holistic approach to pain management, and reinforces evidence-based nursing care. Personally, this project strengthened my skills in research, leadership, communication, project management, and staff education. It also highlighted the importance of ongoing education and reinforcement when implementing practice changes within healthcare organizations. References. The project was guided by current evidence supporting multimodal pain management and complementary pain relief strategies. Research consistently demonstrates that interventions such as relaxation techniques, mobility, positioning, and thermal therapies can improve patient comfort and support holistic care. These sources provided the evidence base for the educational materials and project recommendations. Thank you for your time and for reviewing my practicum project.